Welcome everyone to this week's episode of Basking in the Spotlight. BASC is the Behavioral Alliance of South Carolina, which is a grant-funded initiative of the South Carolina Department of Education's Office of Special Education Services, facilitated by the University of South Carolina's School Behavioral Health Team. My name is Taylor Davis, and I'm the proud program manager for BASC. This week, we are so proud to have our nominee, Dr. Karen Monahan of Fort Mill School District. She is the coordinator of psychological services and an incredible human. That is one hat of many that she wears. We're going to be speaking with Karen about the many roles that she plays within the district today. And with that being said, and with a great amount of excitement, I'm going to turn it over to Karen to share with you all a little bit more about all of the hats that she wears and who she is within Fort Mill School District. Hello, Karen.
Hello, Taylor. Thanks for having me on today. I really appreciate it.
It is our privilege.
As far as the many hats, like you said, I'm the coordinator of psychological services for the school district. This is my 8th year in the position. It's my 13th year in the district. The first 5 years, I served as a school psychologist for a few of our schools here. So as part of my role, of course, as psychological services, you suspect that I support the school psychologists, but also the behavior interventionists and the mental health counselors. I work out of the Office of Special Services, so a large part of my role involves supporting students with disabilities, either on IEPs or 504s. But I also co-chair a couple other district-wide committees. One is our crisis committee, our district crisis committee, and then another is our MTSS committee on the SEL side of things.
So I have to put a plug in here. I've had an incredible opportunity to be able to work in the past as colleagues with Karen and implementing some of these critical structures and supports for Fort Mill School District. And when, one of the greatest honors that we have within BASC is to be able to show what our boots on the ground really look like, what it really means to love our kids and to love our faculty and our staff. And you're such an incredible testament to that with all of the work that you do and how you spread yourself out in terms of just being able to provide yourself as a resource and a support. And one of those critical pieces of your puzzle has been leading the district-wide MTSS implementation. Is that correct?
That is more, we have a director of academic interventions, Amber Smith, who oversees the bulk of MTSS. Where I come in and help co-chair with her is around the SEL behavioral side of things.
So for our community, we do use a lot of acronyms. Could you talk a little bit about what SEL is and how important it is to the work that we do for youth who may be at risk or youth that are in receiving special education services, and what that looks like for Fort Mill School District?
Yeah, sure. It's interesting because most of us in education are used to looking at the triangle of the tiered supports, right? Tier 1, everybody has access to those, just good instruction in the classroom. Tier 2, kind of layering on a little bit of extra support. Tier 3 are more intensive kids. And so when you think about the triangle and how you should build it, I think most of the times you try and go from the bottom up. But I will say in our district, especially in my role, being out of the Office of Special Services, maybe we did it backwards, We really kind of started, or at least the work that I've done in the 8 years has really started more at the top of the triangle and then worked our way down. I'll say that to me, SEL is so broad. I mean, it encompasses everything that we want our kids to be successful. We look at, the 21st century graduate, underneath the South Carolina model, and more than half of those things relate in some way to SEL. And so you think about it, really needs to be infused at all levels. but what I found is if you think about infusing at all levels from the beginning, it's just overwhelming. And then it's hard to say, well, how do you break it down so that you can start making a difference in your district? And so for us, when I came on, the critical need at the time was on our crisis response. I had had some experiences as a school psychologist that helped show me that we needed to be on the same page across schools and across professionals when it came to responding to our crises in the district. And so the first year, it was really like, okay, this is the need. So how are we going to respond to this need? You know, taking a bite out of the elephant, so to speak. You can't do the whole elephant at the same time. So we formed a crisis committee, and then first talked about how are we going to get training for us for crisis response. So we brought in the prepare model and relied on good community partners that we have. We're blessed to have Dr. Melissa Reeves right down the road at Winthrop University, who's, you know, one of the primary authors of it. So she spent some time with us and helped us get our crisis teams up and running and prepare trained. And then she also helped us develop our initial suicide prevention protocol and threat assessment protocols, which, as you know, through our work together has evolved, and we revamped the suicide prevention and response protocols in the last couple of years with your help, Taylor. So, but I guess the point is, you know, that first year, those first couple of years was really focused more on that top of the triangle, our most at-risk students that are in crisis, and making sure that we were helping them, supporting them in a consistent way using best practices.
It's so important that conversation to, you know, and I really love the analogy of taking the bite out of the elephant, right? Because it does feel so big, because you want to be able to look at how you support all of the students and what you're going to be doing for the community, but then it can become almost a barrier. So to break it down and say, all right, what are our critical needs, and to focus on those. And what I heard you say also was it was important for you to make sure you're being collaborative and that you had stakeholders at the table and you were being needs driven and sticking with fidelity of what you were doing. So can you talk a little bit more about the role of teaming and collaboration and fidelity, and how that works for Fort Mill?
Yeah, so to just carry along with the district crisis team, we developed a structure for that which pulled an administrator from each level, elementary, middle, high school, a school counselor from each level, school psychologist, mental health counselor, behavior interventionist, student services. We had SRO on the committee. I'm trying to think who else was there at the time when we first started, but the idea was to get a really representative sample across those that would be actually responding from a mental health perspective, but also administrators, so that we were all on the same page with how the protocols would be carried out. And that's critical, because you can't do it, one side can't do it without the other.
Well, and I think that teaming too, you know, it promotes empathic response and almost that social emotional learning for us as adults, and how we're responding appropriately and developmentally appropriately for our students. Because if you've got representation from elementary, middle, and high, having these conversations about what works, what doesn't work based on level, then you're really all having the same conversation, but ensuring that you're speaking appropriate language, right?
Yeah.
So what would be some of or I guess, are there any ways that as community members, as parents, caregivers, youth, that we could promote involvement and support of these types of initiatives, whether it's around social emotional learning, crisis response, or engagement? Do you have any kind of like feedback there?
Well, I think one of the most powerful things we can do is when we're doing work with our kids is making sure parents understand kind of the lessons that we're doing or the goals that we're working on, so that those things can be generalized at home. So I think about bringing parents in as partners and having them be part of our planning where they can, and at least sharing what we're doing, so that they understand how they can support the kids at home. And as far as community partners, we've also been very blessed, besides the partnership with you and Dr. Melissa Reeves along the way, to have a strong partnership with NAMI. NAMI comes to our district and does Ending the Silence program with all of our 9th grade students. We've also had a strong partnership with Keystone to work on substance abuse prevention. So we've been very blessed to have good, strong community partners and a very strong parent involvement in our school district as well.
If you had to provide some guidance on how you kind of went about creating those relationships, what did that look like for you? Because you've been with the district for some time, but I know that some of those partnerships you really went after as well.
I don't know as far as anything specific. I feel like sometimes the stars just aligned. I think the relationships were already there. I mean, I think it really boils down to relationships that you have within the district and outside, and maintaining those relationships, and working toward the greater good, which in Fort Mill, it's always children first every day. That's the motto. So to me, it boils down to just maintaining those relationships or building those bridges where you can, again, finding the need, and kind of how you can work together as a community to help support the kids and staff.
Yeah, I love the motto of children first, and I love the amount of collaboration and teaming and coordination that goes on within the work that you all do within the district. And I think your work, as well as the Fort Mill School District as a whole, really shows how much our schools are truly the heartbeat of our community. And if we're activating those resources and we're really bringing everybody together to the table, the powerful work that can be done. And I'm so grateful that you all uplift that and put that on a pedestal. And specifically you, Karen, that you're such an incredible voice for making those things happen. Like I've shared before, we've been able to work together, and I've seen you just as an advocate, as an ally, as a fierce supporter of not only social emotional learning, but just being comprehensive in the way that we're looking at the work. And I'm so proud to be able to have you bask in the spotlight, and that you were nominated to come and speak with us today. It really warms my heart in the most powerful way to be able to have other individuals both learn from you, but also get an opportunity to just see you and say how much we truly appreciate what you do for our kids. And you really do put children first, and we want to make sure that we get the opportunity to put you first every once in a while. So with that being said, we like to end our basking in the spotlight with a message that you'd like to share, maybe with the community or with the kiddos, or just with the systems at large, around maybe some hope or some insights that you may have.
Yeah, well, thank you so much. It was an honor to be asked to be here, and I really appreciate it. And I appreciate all the work that I've been able to do with you as well. So, as far as hope, I think we're in kind of we are in a strange time, an unprecedented time right now. But what has warmed my heart this spring is to see how everybody has pulled together to do the best we can with, such unusual circumstances. And whether that's the MTSS committee trying to figure out what to do next and where to go next with social emotional learning, or just our everyday support of students with their academics and how we're going to move forward. I think the key message is collaboration is the key. Working together, working across the aisles is the key in order to kind of move things forward. And I know we can do it because we have done it. And we will continue to meet the challenges to get through this part as well.
I 100% have no doubt in any way, shape, or form that y'all will continue to raise the bar and rise above it every moment, especially with you at the helm, Karen. There's nothing that Fort Mill can't do. I
appreciate that, but it's not just me. Honestly, I feel like we're just really blessed to have support all the way from the school board through the district administration, you know, above me, to all of the people with, you know, the boots on the ground, the teachers and psychs and related service providers and school counselors. I really feel like we're just blessed as a whole to kind of have everybody together.
I love it. We've got it. The more gratitude, the more appreciation, the more validation we can show, especially during these times and always moving forward, the more powerful our systems are to put children first, as Fort Mill says. So I want to thank everybody for joining us today and basking in the spotlight. You can find this on our YouTube channel, or you'll be able to access us on Facebook at Advancing SBH. That's the School Behavioral Health Community. We can also be connected through www.schoolbehavioralhealth.org /BASC. You can see information around our upcoming webinar on the 25th of this month with Dr. Aiden Iacchini, where we'll be discussing how to improve or how to reduce high school dropouts by use of motivational interviewing. And then we'll also be featuring a series on our Working Through It Wednesdays regarding cultural responsiveness. So look out for more information there. If you would like to nominate anyone to bask in the spotlight, whether it's an individual that's embedded within your education system or one of our incredible community partners who supports our education system, a parent or even a youth, please reach out to us at BASC@mailbox.sc.edu. Dr. Karen Monahan, thank you so very much for your time. Thank you so very much for everything that you do for our communities throughout South Carolina. And thank you so much for being an incredible friend and colleague as well. I'm so grateful we got to chat today. And I look forward to seeing everybody at all of our next opportunities and engaging with you all as well. A big thank you from the entire BASC team, Karen, and a big thank you to our community at large.
Thank you, Taylor. It was great being here with you.